Today we shall discuss about the chemistry of thyroid and anti-thyroid drugs. First, let us see a brief introduction about what is a thyroid. What are different diseases that arise due to thyroid abnormalities, either increased levels of thyroid or decreased levels of thyroid. So, thyroid hormones are essential. What is the use of thyroid hormones first? These are useful for the normal development, differentiation, growth and metabolism. The thyroid hormones are very, very important for metabolism, growth and development. These are iodinated amino acids. So, thyroid hormones consist of the important element iodine. Okay, these are iodinated amino acids derived from L-tyrosine. So, you will get a question like this. What is the starting material or thyroid hormones are derived from the following amino acid? So, you will get a phenylalanine, histamine, tyrosine, alanine. Okay, answer is tyrosine. So, which isomer is responsible for the formation of the thyroid hormone? That is L-tyrosine. Okay, these are synthesized in the thyroid gland and stored as amino acid residues of the thyroglobulin. Okay, so these are synthesized in the thyroid gland. So, if you see thyroid hormones T4 and T3. So, name itself indicates that there are 4 iodines. Okay, so here the important point to be remembered is the thyroid hormones consist of iodine. They are derived from tyrosine. Okay, and if you see the structure 3,5,3,5 tetraiodo. So, what is the position of iodines? 3 and 5. 1, 2, 3, 4, 5. Okay, 1, 2, 3, 4, 5, 6. Okay, 6. So, here 3 and 5. Position of iodines is 3, 5, 3, 5, 3 dash, 5 dash. Okay, tetraiodothyronine. So, tetraiodo, 4 iodines. That is why it is T4. The name of T4 is tetraiodothyronine. Position of iodines 3 and 5. So, 3, 5, 3 dash, 5 dash, tetraiodothyronine is called T4. What is 3, T3? So, name itself indicates only 3 iodines. That too, what is the position? 3, 5 iodine and 3 dash iodine. Okay, so 3, 5 iodine and 3 dash iodine. 5 dash iodine is missing here. Okay, iodine here, 5 dash iodine is missing here. Okay, okay, here 5 dash iodine is missing. So, it is 3, 5, 3 dash, 5 dash triiodothyronine. So, T4 and 3, 5 tetraiodothyronine and triiodothyronine. Positions are 3, 5, 3 dash, 5 dash, 3, 5 and 3 dash. Now, let us see different diseases involving this thyroid gland. So, hypothyroidism. What is hypothyroidism? Hypothyroidism is due to thyroid hormone deficiency. That is why it is hypothyroidism. And goiter. It is goiter is what? Goiter is a disease that is arising due to iodide deficiency. Thyroid deficiency is hypothyroidism. Iodide deficiency is goiter, of course. This results in the enlarged thyroid gland. This results in enlarged thyroid gland. Next, what is cretinism? Congenital thyroid deficiency. That means during the birth itself, okay, there will be a deficiency of this thyroid hormone. So, congenital thyroid deficiency is called cretinism. It is an irreversible growth and mental retardation. So, this is from the birth itself. So, the deficiency of thyroid hormone, congenital thyroid hormone deficiency leads to cretinism. This is irreversible. Next, what is myxedema? Is nothing but hypothyroidism. It results in lethargy, fatigue, cold intolerance, weakness, hair loss and reproductive failure. Hypothyroidism, that is called myxedema. Next, what is hyperthyroidism? Hyperthyroidism results in insomnia, high heart rate, eye disease and anxiety. Okay. Here lethargy and fatigue and weakness, okay, hair loss, reproductive failure, it is due to hypothyroidism. Hyperthyroidism is overstimulation of thyroid hormones, okay, that leads to insomnia, sleeplessness, high heart rate, anxiety. What is Graves' disease? Graves' disease is due to hyperthyroidism, continual stimulation of thyroid hormone, synthesis, continuous thyroid hormone synthesis. If it is deficiency, that is hypothyroidism. If it is continuous hormone synthesis, that is hyperthyroidism. Deficiency leads to the diseases like goiter and cretinism and myxedema. Whereas continuous stimulation of thyroid hormone, hyperthyroidism, leads to Graves' disease. Graves' disease and Hashimoto disease. What is Hashimoto disease? Thyroid gland is gradually destroyed. That is, it results in hypothyroidism. Okay, so which of the following disease is due to hyperthyroidism? So you will get cretinism, goiter, myxedema, Graves' disease. So hyperthyroidism is Graves' disease. Rest of the diseases what we have discussed all are hypothyroidism, or congenital hypothyroidism is cretinism. Iodine deficiency is goiter. Next, thyroid gland is gradually destroyed, that is Hashimoto disease, and it is due to it results in hypothyroidism. Then how this thyroxine hormone will metabolize? If you see here, this is T3. Okay, this is T3. Okay, thyroxine. So this is the structure where if you see the points, these are the iodines which are involved in deiodination. So during metabolism, it undergoes deiodination, and this OH involves in conjugation reaction, and this ether bond cleaves during this metabolism, and this amination will be removed and it results in oxidative deamination. Okay, so the outer ring and inner ring iodines will get deiodinated, amine will get deaminated, ether undergoes cleavage, and oxygen OH group involves in conjugation. These are the points where the thyroid hormone undergoes metabolism. Next, let us see some synthetic thyroid hormones which should be given during this thyroid deficiency. So these are the drugs which are used to treat hypothyroidism. Okay, so first drug is levothyroxine. Levothyroxine, it is nothing but T4. Levothyronin, okay, levothyronin is T3. Levothyroxine is T4, thyronin is T3. This is a synthetic form of T3, levothyronin. Levothyroxine is used to treat hypothyroidism, is also used to prevent this goiter. Okay, so these drugs are used to prevent the goiter and also used to treat hypothyroidism. Next, Liotrix. Liotrix is a mixture of sodium salts of T4 and T3 in the ratio 4:1. Okay, Liotrix is a mixture of T4 and T3. T4 is 4 and T3 is 1, 4:1 ratio. Next drug is dextrothyroxine. It is a synthetic plus isomer of T4. So T4 is dextrothyroxine and levothyroxine. Radioiodine is also given. This dextrothyroxine is given hypercholesteromic hypolipidemic therapy. Okay, it is given in hypocholesterolemic and hypolipidemic therapy. Next, radioiodine, iodine 131, iodine 125. Remember this isotope numbers, iodine 131 and iodine 125. These are also given to treat this hypoparathyroidism. Next, percolates are also the drugs which are used for both diagnosis and treatment of this thyroid disease and thyrotoxicosis. So, which of the following drug is used for the diagnosis as well as treatment? That is percolate containing drugs. Next is pertechnetate. It is also a radiopharmaceutical used for the imaging of the thyroid gland. All these are the drugs which are used for hypothyroidism. Levothyroxine, liothyronin, that is T4, T3. Liotrix is a mixture 4:1 of T4 and T3. Dextrothyroxine, radioiodine, percolates and pertechnetate. Okay, these are the drugs for thyroid deficiency. Now let us see this anti-thyroid drugs. Okay, that means what? Drugs which are used to treat hyperthyroidism. Okay, so here anti-thyroid drugs are compounds that act within the thyroid gland to inhibit the biosynthesis of thyroid hormones. Excessive amount of thyroid hormones in the circulation are associated with Graves' disease, toxic adenoma, goiter and thyroiditis. Okay, so excessive amount of thyroid hormones in the circulation leads to Graves' disease. Okay, next. So, different types of anti-thyroid drugs. Classification, these are classified into different types. Thiourulins, polyhydric phenols, ionic inhibitors and miscellaneous. Thioureulins. What is the mechanism of action? Again, these thioureulins are divided into three types. Thiouracil derivatives, imidazoles and aniline derivatives. Okay. Thiouracil derivatives and imidazole derivatives are having this mechanism of action. They interfere with the process catalyzed by the thyroid peroxidase such as iodide oxidation and coupling of iodine iodothyrosin. So, the process which is involved in the synthesis of thyroid hormone. So, that process involves the processes like iodide oxidation and coupling of tyrosins. Okay, iodotyrosins coupling. That process is inhibited and process catalyzed by this thyroid peroxidase such as iodide oxidation. So, iodide oxidation is a process during the synthesis of thyroid hormone which is catalyzed by peroxidase enzyme, thyroid peroxidase enzyme. Thus, thioureulins, especially thiouracil derivatives and imidazoles interfere with this enzyme so that synthesis of thyroid hormone is stopped. Okay. Then examples of thiouracil derivatives, methyl thiouracil, propyl thiouracil, methyl thiouracil and propyl thiouracil. Imidazole derivatives, carbimazole and methimazole, imidazole derivatives, carbimazole, methimazole. Next, aniline derivatives, mechanism of action. These agents interfere with some of the process catalyzed by the thyroid peroxidase such as iodide oxidation. So, the same process here and organification and coupling of iodotyrosine. So, almost the same. Organification process is also being inhibited by this aniline derivatives. Examples are all sulfanilamide, sulfaguanidine, carbitamide and para-amino salicylic acid. These are also the anti-thyroid drugs. This sulfaguanidine, sulfanilamide, okay. These are aniline derivatives which are used as anti-thyroid agents. Next, phenols, polyhydric phenols, same mechanism of action. Example is resorcinol. Ionic inhibitors, these anions resemble iodide ions and affect the power of thyroid gland to accumulate the iodine. So, it inhibits the accumulation of iodine. So, these are ionic inhibitors. Examples, percolates, potassium percolate, thiocyanate. Miscellaneous agents, lithium carbonate and adrenergic blockers. So, examples again we will see thiourulins are divided into three types. Thiouracil derivatives, methyl thiouracil, propyl thiouracil, imidazoles, carbimazole, methimazole, aniline derivatives, sulfonamide, sulfaguanide, carbitamide, para-amino salicylic acid, polyhydric phenols, resorcinol, ionic inhibitors, potassium percolate and thiocyanate, miscellaneous agents, lithium carbonate, adrenergic blockers. So, if you see important structure, so uracil, this is the pyrimidine derivative. Okay, uracil which is containing this pyrimidine ring. Okay, this uracil, propyl uracil and methyl uracil. If you have here methyl, that is methyl uracil, and propyl thiouracil, you will be having this propylene group. Okay, 1, 2, 3, 3 carbons. Okay, and this is a uracil structure. If you see, there is similarity here, C double bond O, NH, N. Okay, NH. The double bond CO. Okay, C double bond O. This carbon is replaced with the thio, S group, sulfur group. Rest of the molecule is same. Okay, this C double bond O is there here, and this substitution over this carbon. Okay, substitution here. So, 6 propyl, 2 thioxo, 2, 3. Okay, 6 propyl, 2 thioxo, 2 and thioxo, 2, 3 dihydropyrimidine 4-ol. Okay, so here. So, if you see here, propyl thiouracil and this is methimazole carbimazole derivative. Okay, so here methimazole and carbimazole imidazole derivatives. This is the imidazole here and thione. Okay, imidazole derivative with thione and substitution with the methyl group. So, this is uracil derivative, thiouracil derivative, and this is imidazole derivative, methimazole. Methimazole, if you treat with acetates, okay, you will get carbimazole. Okay, Here Cl, COO, C2H5, just simple loss of HCl. You will get here COO, C2H5 bond group over nitrogen. So from methimazole, you can synthesize this carbimazole. Okay, these are the important drugs. Next, 2-thiouracil derivatives. 2-thiouracil derivatives shows tautomerism. Okay, 2-thiouracil derivatives shows tautomerism, that is 4-keto 2-thiopyrimidine is the tautomer. So if you see here, there is a tautomerism here, 1, 2, 3, 4, 5, 6. So this OH group undergoes tautomerism. Okay, keto-enol tautomerism. Okay, so this is all enol, this is keto form. It undergoes, shows tautomerism. 2-thiouracil shows tautomerism. 4-keto 2-thiopyrimidine. 4-keto 2-thiopyrimidine. These two are the isomers. Okay, tautomers of the 2-thiouracil. Side effects is agranulocytosis. Side effects of thiouracil is agranulocytosis. So if you see here, which of the following drugs shows tautomerism? So here 2-thiouracil shows tautomerism because you have this OH group here and double bond here. So it undergoes tautomerism to give this. Okay, so keto and enol tautomerism. Keto enol tautomerism. Agranulocytosis is a side effect. So agranulocytosis is a side effect. Okay. So these are the important points which we have covered in the thyroid gland and anti-thyroid drugs. Thank you.